Peace be with you and welcome to another edition of Medicine of the Mahdis. My apologies, I've been away for a while, but now we will endeavor to make the episodes more frequent. We'll try and do 2 or 3 videos per week. So keep your questions coming in. So today's questions, there are actually 2 that I'm going to read out. The first one is from Thamina B. And Sister Thamina says, Assalamu alaikum brother, I would like to ask if there is anything you can recommend from Medicine of the Mahdis for anxiety and anxiety attack. When I start to feel anxious, I start to feel hot, my heart rate starts to go up really fast, I can't control it and find it hard to calm myself down. It can last from 5 minutes or longer, not really timed it. I take deep breaths. By the time it calms down, I feel drained, tired and sleepy. Brother Tamani Hamza also asks, hi, how are you? What is the cure for asthma and insomnia? Brother Tamani and Sister Thamina, you've asked questions about sleep, about anxiety, and about asthma. Now, I've had a lot of questions about these topics and others such as tiredness. We've had questions on diabetes. So I thought today we'll talk about one of my most favorite secret weapons in the fight against stress, against insomnia, against asthma, against epilepsy, against heart arrhythmias, and the list goes on and on. And the subject today is about the mineral magnesium, the antidote to stress, the nature's Valium. Magnesium is something that is not really talked about much in terms of the healthcare systems in the Western world, but private doctors do utilize it a lot in their patients to deal with all sorts of problems. So, to understand what magnesium is and to then be motivated to take it is something that I think is related. So what is magnesium? It's a mineral. It's something that occurs in nature and it's found in all kinds of foods. So I said it's the relaxation mineral. What do I mean by that? What I mean is that magnesium essentially in your body head to toe, it relaxes. It's the opposite of calcium. So calcium causes muscle contraction. Magnesium is more to do with muscle relaxation. Muscles are all over your body, from your airways surrounding the bronchi, from your gut surrounding the intestines, from your blood vessels. Muscles are everywhere, and magnesium works very closely with muscles, with nerves, and all kinds of reactions in the body that produce proteins and control blood sugar, make energy, the ATP molecule. Magnesium is involved in hundreds and hundreds of enzyme reactions in the body, and it works as a cofactor in a lot of these crucial functions. So, if you think you could be deficient in magnesium, unfortunately, a blood test will not give you too much information about it because most of the magnesium we have is stored in our bones, in our soft tissue, and in our muscle. Less than 1% is actually floating around in the blood. So a blood test won't be able to tell you that you're deficient. But coming to its properties. Now, specifically, you talked about anxiety and insomnia. I want to address these 2 first. So in your brain, there are nerve cells, and those nerve cells at the end, if you picture these rods, they have these chemicals spurting out of them, and these chemical messengers are what make us think, are what make us sleep, and the biochemistry in the brain is very much determined by what happens at the end of these nerves. Magnesium acts as an inhibitory molecule. It slows things down, it relaxes, and in the brain, magnesium can actually go into the brain and really help with relaxation. It can improve cognitive performance, how well you're thinking. It can affect with sleep, depression, anxiety. There have been many studies done on this. So the type of magnesium is also important to consider. Because magnesium doesn't just exist as an element in and of itself, it's always bound to something else. And what it's bound to is absolutely crucial so that you can treat that specific problem. So for example, if you have constipation, you will take magnesium citrate. This form of magnesium acts mainly in the intestines, in the bowels, and helps to relieve symptoms like constipation. We've heard of milk of magnesia, for example. In the brain, however, magnesium citrate can't get into the brain. Why? Because of something called the blood-brain barrier. There is a barrier that prevents magnesium going into the brain and acting on the brain to treat conditions like anxiety and insomnia. So what type of magnesium do you need for this purpose? The type of magnesium I really recommend is called magnesium L-threonate. That's magnesium L-threonate, and it's spelled T-H-R-E-O-N-A-T-E. Magnesium threonate can actually go past the blood-brain barrier directly into your brain, and it begins to have effects almost within half an hour to 1 hour of taking this tablet. You should take it around bedtime. And the dosage for it is higher than the other types of magnesium. So you can take up to 2,000 milligrams safely every night, and you will notice that your sleep is significantly better after a few nights of taking this type of magnesium. And not just your sleep, but your general relaxation, because it's a muscle relaxant. It has a relaxant effect on the body. And you can further increase that by taking it with something called apigenin. And it's something that's extracted from things like chamomile, which we know has relaxation effects, and also from the peels of certain fruits like grapefruits. And apigenin taken with magnesium L-threonate can really, really help with things like anxiety and insomnia. It's completely natural. It has none of the side effects of the benzodiazepines that doctors often prescribe for patients, or things like zopiclone, like sleep tablets that are often prescribed for those with difficulty sleeping. This is very easy to take. It doesn't cause the same kind of side effects and dependency that the medicines that I mentioned that your doctors could prescribe can cause, and it's not toxic. You can take it because it's freely available in nature. So it's a big topic, magnesium, because it acts on so many parts of the body, and I want to talk about this because, and one of the reasons for selecting this question on asthma, you think, well, asthma and insomnia are unrelated, but actually there is a relationship, and magnesium connects them. Now remember, I said magnesium is involved in over 300 different biochemical enzyme reactions in your body. So we know that magnesium, which previously, by the way, used to be much more available, we have now estimates that say that in the developed world, in the rich countries of the world, there is a deficiency in magnesium. 50 to 70% of people are estimated to be depleted in magnesium. So we know, for example, that people who come into the intensive care unit and they had their magnesium levels checked. Now, these are very sick patients, of course, but a huge majority of these patients actually were deficient in magnesium. And then, by extension, they saw, well, why are they deficient? Because magnesium is taken out of the treatment system. Before, we used to get it from river water or lake water, which is rich in magnesium, mineral water. But now our taps are completely almost empty of magnesium. And that's one of the big reasons. Other reasons are medications you take. And people who take proton pump inhibitors, lansoprazole or meprazole, people who take diuretics for blood pressure, things like furosemide, Lasix, it has different names, but diuretics and these acid tablets actually prevent you from absorbing magnesium, and that and a combination of water treatment is the reason why such a huge swathe of the population is deficient in this absolutely essential mineral. So I would really recommend anybody who has any symptoms of muscle stiffness, insomnia, anxiety, depression, even things like attention deficit, anybody who has asthma, epilepsy, and the more serious conditions, diabetes. We know, for example, people with type 2 diabetes are also, they tend to have a magnesium deficiency. People prone to osteoporosis. Now, it seems like I'm going through the whole body, and it is really because magnesium plays a vital role in all of these. And I'm just trying to emphasize that if you have any of the above conditions, you know, you're like, well, why doesn't my doctor tell me about this? Why isn't this discussed? Actually, this is one of the most interesting things about magnesium. As physicians, as doctors, as somebody who myself has worked in the emergency department, we use magnesium all the time. So if somebody comes in with a severe asthmatic exacerbation, they have a very severe asthma attack, guess what we give them? We give them intravenous magnesium sulfate. If somebody is pregnant and they have a condition called preeclampsia, to prevent them from getting seizures, guess what we give them? Intravenous magnesium. If somebody has arrhythmias with their heart and they're at risk of having serious heart complications like stroke and heart attacks, guess what we give them? We give them magnesium. So why is it that we have to wait for patients to get so sick that they come to the ICU to give them magnesium, but we won't give them smaller amounts of magnesium supplements when they're well? As a prevention, I mean, I thought prevention is better than cure. So if that is the motto that doctors profess, then I think they should really talk about the importance of this crucial mineral in general health and well-being. I really hope that it does make sense to you. I would recommend also reading up about the types of magnesium. So if you have constipation, like I said, it's magnesium citrate is more effective. If you want overall magnesium in your body, in other words, a total body increase in magnesium, the best magnesium to take, so this will affect your muscles, your bowels, and even your brain to an extent, is magnesium glycinate. This is for overall body magnesium. And of course, for the brain, the one that crosses into the brain and helps with insomnia is magnesium L-threonate. So these are the main types of magnesium. I wanted to point something interesting out. If you go to the shops and you pick up magnesium over the counter, most of the magnesium they sell in the shops actually contain, if you read the ingredients, is a specific type of magnesium. And this is the least effective, by the way. I would recommend that you don't take this because it's poorly absorbed and it has the highest number of side effects in your stomach especially. It can cause gas, bloating, diarrhea, and things of this nature, and it's poorly absorbed. So magnesium oxide. So most of the shops that you can buy magnesium from sell magnesium oxide, and this is actually the least recommended of the different types of magnesium. When you're out, make sure you read the label, and if it says magnesium oxide, don't buy it. If you are struggling to get the magnesiums that I've recommended, which is magnesium glycinate, magnesium citrate for constipation and bowel problems, and magnesium L-threonate for the brain, for sleep and cognitive performance, then you can find them very easily online. There are lots of online stores, health stores that sell magnesium with these formulations. So I think I've had a long discussion about it. In terms of the anxiety, I would definitely recommend for you, Sister Thamina, I would recommend that you take magnesium L-threonate. I would take 2,000 milligrams in the evenings, and I would take it with the substance I mentioned before called apigenin, which would be taken at 300 milligrams in the evening along with the magnesium L-threonate. For Brother Hamza, I would say take magnesium glycinate. Magnesium glycinate because it will also help with the asthma as well as the insomnia. So magnesium glycinate would be taken at a lower dosage. I would recommend 400 milligrams a day, best taken with a meal. So have it with, again, dinner. And I hope everybody watching this will include magnesium. Now, there are going to be some people who are going to say, can I get my magnesium through a natural source? And the answer is yes. Magnesium is found and it's rich in all green plants. So spinach contains a lot of magnesium. You've got things like avocados, anything that's green. The reason for its green appearance is because magnesium is the central molecule. Just like we have iron in hemoglobin, which helps us carry energy around the body, plants have magnesium as that central molecule. So if you're having lots of green leafy vegetables, you're going to get good quantities of magnesium. Then you have things like pumpkin seeds, chia seeds, nuts, cashew nuts. All of these things contain a good amount of magnesium. So you can also get it from food supplies, and there are options to do that as well. Someone also asked me about if you can't take oral magnesium, is there any other way to get magnesium. And the Epsom salts are very popular these days because they can actually go through your skin into your system. So anybody who wants to bathe in Epsom salts, which contains magnesium sulfate, this is a good option. But remember, these types of salts are more for athletes who kind of get these sorenesses, or anybody who has a hard physical job and they have muscle stiffness and pain. They put Epsom salt into the bathtub, and yes, it does absorb, but it's a local absorption. It doesn't really get much into your blood, so it can't help with other things like constipation, like anxiety, like these types of things. It's more to do with the muscles that the water comes into contact with. So I've spoken a lot about a lot of different things, and really my recommendation is that I really believe there's a big deficiency in magnesium. I believe that, you know, not everybody has the time or to necessarily eat and cook and prepare foods that are magnesium rich. Of course, I would recommend increasing foods that contain magnesium, but I would also recommend for those people who are getting anxiety, depression, tension, headaches. There are so many conditions, diabetes, who I would recommend them to take supplemental magnesium. So if you've got any further questions, please do write in. I think I'm a big fan of magnesium. I think it should be in everybody's drug cabinet. And I think that it would be one of those things that prevent you from getting sick. And so I'm a big advocate of magnesium supplementation. And thank you for your time. And I look forward to seeing you soon.